Welcome. This episode discusses the sensitive topic of workplace violence and shares a link to a video from Finland showing nurses who are recovering from physical assaults at work. Welcome to episode 15 of the Haelan Nurse Chronicles. I'm your host, Dr. Lori Laws, and today we are diving into a critical and often overlooked issue in the nursing profession: nurse workplace violence. From physical assaults to verbal abuse, emotional manipulation, gaslighting, extortion, lateral violence, bullying, hazing, and various forms of incivilities, nurses face a wide range of violent behaviors in the workplace. It's time to shed light on the harsh realities that many nurses experience on a daily basis and ask some tough questions. Among them is, are nurses being treated as collateral damage in healthcare organizations and systems? Why are 86% of nurses receiving little or no support in dealing with the traumatizing effects of workplace violence? Throughout this episode, we will explore the true impact of nurse workplace violence on the mental and physical health of nurses. We'll discuss the concept of collateral damage and advocate for the prioritization of nurse safety and professional well-being. Join me as we delve into this important and heart-wrenching topic and work together to create a safer, more supportive environment for nurses to thrive. Thank you so much for tuning in. The reality of healthcare, sadly, for millions of nurses is a dark one. Nurses face a myriad of violent behaviors in the workplace from patients and their loved ones, as well as from colleagues and organizational leaders. Workplace violence of all types are categorized as nurse-specific traumatization, and that is avoidable. Today, we'll turn our attention to what nurses in European countries are reporting. In Finland, there is a video that is going viral on social media as nurses describe the violent and dangerous conditions in which they are practicing. Here are a few accounts from that video, and we'll drop the link in the show notes for you. I am getting pushed, beaten, bitten, scratched, reports one nurse with visible facial bruises, even stabbings, which lead to life-threatening conditions. Another nurse, who is shown with a massive black eye, states, patients are scratching, spitting, biting, even throwing things at me. Other nurses who speak out against this violence have been fired. Another nurse says, we've had serious violence, biting so severe that it pierced the hand, which then became infected. And her voice was shaken as she stated that. Another nurse recalled their experience. I have been in court where the patient, now defendant, was convicted of unlawful threats against me. Another nurse goes on to say the patients, their families, they try to influence care and other things by verbal intimidation. The violence, so it has clearly increased, another nurse described. It comes from patients, attendants, on site, and over the phone. She goes on, one of the most common threats is, if you don't do this, that means you want me to die. Well, of course, nobody wants this to happen. The nurse reaches into their pocket and presents a flyer that states 69% of nurses in Finland have experienced violence or threat of it at work. 69%. In Italy, nurses aren't faring much better either. Approximately 38% of nurses have reconsidered their job due to violence, and nearly 25%, 1 in 4 nurses, changed their job or left the profession altogether. Threats were the most prominent forms of violence that nurses faced there, although actual attacks such as spitting, biting, punching, and throwing objects were often also common. Flyers lined the halls and the walls of Italian healthcare settings. These flyers, one of which says, you choose respect. Don't attack those who care for you. Verbal or physical violence against healthcare workers is a crime. And then there's another flyer that depicts a stethoscope with the oscillating piece in a bullseye target. And this one says, who helps you is not a target. Don't hit them. With nurses worldwide, these stories and statistics like this, it begs the question, are nurses being treated like collateral damage in healthcare settings and systems? Despite the high-risk trauma exposure faced by nurses, a staggering 86% of nurses receive little or no support in mitigating the traumatizing effects of workplace violence. It's time to address why nurses are so often overlooked and undervalued in the healthcare system. And also it's time to advocate for the resources and support that we need to thrive in our roles. Excuse me. Nurses who report violence are frequently gaslighted by their employers with the accusatory question that's something like this: what could you have done to prevent this incident? Nurses who report being threatened or attacked are frequently met with more workplace violence in the form of gaslighting, or threat of losing their job, or threat of being reported to their licensing regulatory body. A better question to ask is, what are you, healthcare leader, manager, administrator, organization, or system, what are you doing to make sure that this doesn't happen again? What could you have done to prevent this incident? Where's the employer's root cause analysis? Where's their report? Rare. Rare if ever, and certainly not in Finland or Italy, as has been reported to me. So what we have here then is a cycle of perpetual violence. A patient or family member assaults the nurse. The nurse seeks support in their organization only to be gaslighted in a blame the victim strategy. Then, if the nurse refuses to accept the unsafe assignment, they are threatened with their livelihood or their license to practice. Well, these are just classic examples of avoidable nurse-specific traumatization. And while it does speak to the greater societal challenges that are beyond the scope of today's topic, nurse violence is a never event, meaning that it should be swiftly addressed by the employer. Work conditions should be such that workplace violence should be a never event, just like a sentinel event is a never event. As for those reasons, and so for so many more, that's why I'm here. I have reached a point in my career where I can stay silent no longer, and I'm taking my one grain of sand and doing everything that is within my power to advocate and affect change. I conducted research for over 5 years across 4 disciplines to bring forth an evidence-based framework and a healing program for nurses worldwide. Through my nonprofit organization, the Haelan Academy, we offer safe virtual spaces for nurses to come together and heal through all that they've endured. So if you or someone you know has been affected by workplace violence, gaslighting, bullying, hazing, or any form of workplace incivilities, please attend my free webinar where you can learn if and how you have been affected, and importantly, steps that you can take immediately to start the healing process while learning to insulate yourself from the harsh working conditions. Just click the link and enroll today. drlorilaws.com/webinar. Will take you right to me, right to the webinar, and it will take all of us doing our part to refuse to be abused in the workplace. It will take all of us doing our part to value ourselves as more than just collateral damage. We are the linchpins of healthcare. Together, we can and must come together, heal together, and then be the change agents that usher in Nursing 2.0, the Nurse Safety and Professional Wellbeing Edition. So until next time, thank you so much for tuning in. I appreciate all that you are and all that you do. I see you, I feel you, and I am with you every step of the way, from my healer's heart to yours. And until next time, namaste.